The physical examination of the cardiovascular system consists of 8 main parts that we need to assess one by one. To avoid getting confused during the physical exam and to make sure we don't miss any part, it's better to follow a specific algorithm and system. To help us remember it, we express it in the form of a simple sentence. That sentence is, a good intern pay better attention to his heart daily. G stands for general appearance. I stands for inspection and palpation. P stands for JVP. B stands for blood pressure. A stands for arterial pulse. H stands for heart sounds. The second H stands for heart murmur, and D stands for dynamic auscultation. The first part of the physical exam in cardiovascular patients is general appearance, meaning the information we gather from the patient's appearance, and by following and examining these visible findings, we are led toward cardiac diseases. Stay with me as we review these visible findings together. Let's start from the very beginning. Doctor, what is this condition? Sitting and leaning forward. Bracing slowly. If a patient comes in like this, what kind of heart disease do you think they might have? Aha, it's acute pericarditis. Why do children with acute pericarditis adopt this posture and position? To reduce their pain. Aha, to lessen their pain. What is the cause of pain in a patient with acute pericarditis? The cause of pain in a patient with acute pericarditis is the friction between the layers of the pericardium. We have a visceral pericardium layer and a parietal pericardium layer. Any factor that reduces the anterior-posterior diameter of the chest wall or brings these two closer together increases the patient's chest pain. Therefore, the patient tries to avoid this by leaning forward so that the anterior-posterior diameter of the chest wall increases. And on the other hand, they try not to take deep breaths. They avoid coughing, sneezing, and speak softly because all of these increase the likelihood of friction and the chance that the patient's chest pain will worsen. That's why it's called sitting and leaning forward. Bracing slowly. This is seen in acute pericarditis. What is this, guys? It's called pursed lip breathing. Why does a patient with COPD do this? Because it helps keep the airway open longer, so that they can keep their airways open for a longer period of time. What is this? Next, doctor. This is Cheney-Stokes respiration. What does Cheney-Stokes respiration mean, and in which cardiac patients might it be seen? So, there are periods, guys, of apnea and hyperventilation, meaning the patient suddenly starts breathing rapidly and deeply, then suddenly may stop and go into apnea. If a patient has this, what is one of the differential diagnoses and which heart disease can cause it? Heart failure. The patient has heart failure. Can it also be seen in other diseases? Exactly. In patients with neurological issues like those who have had a CVA, stroke. Patients who have a stroke or brain injury may also show Cheney-Stokes or Cheney-Stokes respiration. Okay, let's have Dr. Shahab answer this. Great. Is this cyanosis peripheral cyanosis or central cyanosis? Central. Yes, exactly. Central cyanosis. If you found the video helpful so far, please like it and share it with your friends. And if you don't want to miss my next videos, please subscribe. What is this, doctor? Who said telangiectasia? This is telangiectasia, kids. Telangiectasia means these web-like spider vein networks. So, a patient comes in with these on their face. What conditions should we consider for them? In cardiology, we see one in mitral stenosis. This is seen in rheumatic mitral stenosis and in scleroderma, since scleroderma can have cardiac presentations. What is this, doctor? It's a type of mottling. What's it called? Livedo, that's right. Livedo reticularis. A patient comes in and you see this on their legs. With livedo reticularis, what cardiac condition should we consider? Livedo reticularis can be seen in patients with cardiogenic shock. Its non-cardiac causes can include cold exposure and autoimmune diseases. Alright, who wants to answer this? Dr. Yu. Kids, this tan or bronze skin is usually seen in hemochromatosis. What are the cardiac presentations in a patient with hemochromatosis, kids? Its cardiac presentation can be in the form of cardiomyopathy, arrhythmia, and even sudden cardiac death due to embolism. What is this? This is petechiae purpura ecchymosis. Do you agree? So therefore this is petechiae. 1 to 2 millimeters is purpura. More than 3 millimeters is ecchymosis. Usually it's larger than 1 centimeter. If you see this, what would you suspect from a cardiac perspective? Aha, it could be thrombocytopenia. The patient may have used anticoagulant medication. A patient with endocarditis. Well done, who said that? What is this? Xanthoma. If we see xanthoma in a patient, we think of familial hyperlipidemia. But those with familial hyperlipidemia are prone to premature atherosclerosis. That means the patient might present with an MI. If you see a face or a picture like this, you should act quickly. Check LDL, TG, cholesterol, and assess the coronary status. What is this? Let me explain. Maybe it doesn't show well in the pictures. It has a cobblestone appearance, like paving stones. This is called pseudoxanthoma elasticum. The cardiac feature of pseudoxanthoma elasticum is that it causes premature atherosclerosis. This means they can have myocardial infarction at a young age. Following an MI, they may develop heart failure and even worse. These atherosclerotic plaques can also be present in the lower limb vessels, leading to claudication. Alright, whose turn is it? Come on, doctor, you tell us what this is. A dark black spot on the skin, lentigo. These lentigo lesions are usually seen in cardiac syndromes. Guys, we have a number of syndromes in cardiology called Leopard, Lamb, Carney, myxoma, and others. If we see these dark skin lesions, we definitely need to check the patient for cardiac and other organ involvement. If the lentigenes increase and cover the whole body, it creates a syndrome called, guess what? What animal does it look like? It looks like a leopard, of course. What is leopard in English? What? Tiger means babe. Leopard or leopard. In Persian we say leopard. Leopard, or the so-called leopard syndrome. These patients usually have multiple lentigenes. They have conduction abnormalities. On their ECG, they might have AV block. They have pulmonary stenosis. What is Carney syndrome, guys? In Carney syndrome, these patients usually have myxomas or left atrial tumors, along with endocrine gland disorders and schwannomas, and all of them have lentigenes. What is this? This is called lupus pernio, kids. In which heart disease is lupus pernio seen? A disease that involves cardiac sarcoidosis can present itself as lupus pernio. What is this? Ring-shaped lesions, well done. Where is granuloma annulare seen? In the skin itself, and what about in the heart? For example, if you see this, which heart disease would you suspect? Sarcoidosis. So what is this? Erythema nodosum. Erythema nodosum also appears as plaques and nodules under the skin on the legs. What disease do you have? This is also seen in sarcoidosis. Again, my children's sarcoidosis. Whose turn was it next? I want you. You said it. Should I say what your comment is next? Oh, that's called high arched palate. Well done. It's seen in Marfan syndrome. What kind of cardiac presentation might a patient with Marfan syndrome have? Aortic aneurysm, aortic dissection, and mitral regurgitation, or aortic insufficiency. What is this? Should I give you a hint? Large tongue. In amyloidosis, a number of abnormal proteins deposit in the body. If they deposit in the heart, it presents as heart failure, cardiomyopathy, and AV block. In the tongue, it makes the tongue larger. So in a patient with a prominent protruding tongue, we see amyloidosis. What is this? Bifid uvula. Well, in which disease do you see this? I already told you. There's a disease where when you open the mouth, you see that the uvula is split in two. LDS, right? The disease called Loeys-Dietz syndrome. LDS, Loeys-Dietz syndrome. These are people whose cardiac presentation appears as aortic tortuosity and aneurysms of the large vessels. Okay, what is this? Orange tonsils in dyslipidemia disease, known as Tangier disease. These dyslipidemias have yellowish tonsils, and we said that any kind of dyslipidemia predisposes the patient to atherosclerosis and MI. So whose turn is it now? Dr. Irfan Habibi, you are our colleague. Alright, say the next one. What is the cardiac presentation of Noonan syndrome, guys? Which specific disease does it indicate? What does someone with Noonan syndrome have? What do we immediately look for? We look for pulmonary stenosis. People with Noonan usually have pulmonary stenosis. What about Turner? Turner patients are more likely to have aortic involvement, such as aortic aneurysm or aortic dissection. What about those with Down syndrome? They usually have AVSD, meaning they have both ASD and VSD at the same time, which we call AVSD. What is this? Oh, well done. In whom precisely is this condition typically seen? It is primarily observed in people who have Graves' hyperthyroidism. If a child has Graves' disease or hyperthyroidism, what heart problem should we suspect? As I wrote, they may develop tachycardia, possibly atrial fibrillation, and because they are tachycardic, they might develop tachycardia-induced cardiomyopathy. They may also develop atrial fibrillation. Okay, who's supposed to say the next one? Irfan Habibi said, Doctor, you say it. What is this? This is from pediatrics. You should remember it. Aha! Blue sclera, and their legs are like this. Their bones. Aha, they develop multiple fractures. What do you call spontaneous fractures? Bravo! Osteogenesis imperfecta. These patients, due to a defect in their collagen system, experience frequent fractures in various parts of their bodies, even without any trauma. And the most common cardiac involvement in them is aortic root dilatation, because the wall of the aorta in these patients also becomes aneurysmal, due to the same collagen system defect. Other cardiac causes in these patients may present as mitral and aortic regurgitation. This is the same lacrimal hyperplasia that we mentioned, which is seen in the syndrome or disease known as sarcoidosis. So lacrimal gland hyperplasia. Who is this? Who is this? This disease has a malar rash, meaning there is a rash and redness on the cheeks. It is seen in lupus within the context of heart disease. For example, if you see this and it's not lupus, what heart disease could cause this? If you remember, I mentioned telangiectasia in the car. It can also occur in rheumatic mitral stenosis. Therefore, we should suspect mitral valve stenosis. What is this? Aha, saddle nose. Saddle nose, a distinctive nasal deformity, is frequently observed in cases of Wegener's granulomatosis, a severe autoimmune disease, and also in the chronic inflammatory condition known as relapsing polychondritis. Polychondritis can also cause the nose to look like this. When you see this nose, you should quickly check the heart. Aortic insufficiency, mitral regurgitation, and specifically aortic aneurysms and conduction disorders in the cardiac system can be seen. Alright, mention this. Well done. This is the normal one, guys. Normally, when we put two of our fingers together, a diamond-shaped space should form between the nails of our fingers. But in people who have clubbing, these are separated from each other, and that normal diamond shape we should see is absent. What sign is this called? Whoever says this, I'll give them a point at the end of the section. You have 3 seconds. 1, 2, 3. It's called the Shamroth sign. Alright, whose turn is it next? Okay, doctor, long, slender, and beautiful fingers. Marfan, well done. What is it called? Arachnodactyly is seen in Marfan syndrome, and if you don't see Marfan, what do we immediately think of? Aha, aortic aneurysm, dissection, mRNAi. Alright, doctor, since you're interested, the next case is yours. On the soles of the feet, there are masses. Well, not exactly masses. You can see flat red-colored plaques. What are they called when they appear on the palms and soles? And in which heart disease are they seen? I'll say the name. Janeway lesion. Janeway lesions appear as painless, hemorrhagic spots on the palms and soles and are seen in endocarditis. This other one appears as raised, tender nodules. What are those called? Exactly, Osler's nodes. And where are those seen? They're seen in endocarditis as well. What is this? Linear hemorrhages under the nails. Come on, this one is really easy. That's also seen in endocarditis. What is it called? Splinter hemorrhage. So there are 3 endocarditis findings on peripheral physical exam. Osler nodes, Janeway lesions, and splinter hemorrhages. These are the ones we need to pay attention to. What is this? The tips of 2 of his fingers are necrotic. This is usually seen in diseases like Buerger's disease. Yes, Buerger's. And thromboangiitis obliterans. What is this? This is called venous insufficiency. That is, it happens due to the varicosity of the lower limb vessels. It's more common on the medial side of the foot. They have hyperpigmentation, and the ulcers are moist with little pain. These usually aren't very painful. Chronic venous insufficiency. Who is this? A big belly is seen in which syndrome? It's seen in metabolic syndrome. It's seen in Cushing's as well. It's also seen in people who have HIV and in those who use antiretroviral drugs. Their cardiac presentation is usually in the form of premature atherosclerosis, and they may also have heart failure. This is called lipodystrophy. So what sign is this, guys? This is called the Hohmann sign, guys. What is the Hohmann sign? In a patient who has a DVT in the calf, when you perform dorsiflexion of the foot, meaning you see here it brings the foot upwards. We perform dorsiflexion. The patient feels severe pain. So this is called the Hohmann's sign. What is this? Collateral vessels on the chest. What heart disease could cause this? A disease that has SVC syndrome. Why? When your SVC is blocked, the SVC is here. It can't drain the blood. inside the right side of the heart in the right atrium. So it has to form collateral vessels on the surface of the skin to drain into the IVC. All right, what's next? What is this called? What is this called? Well done. This is pigeon chest or pectus. We have pectus excavatum. We have pectus carinatum. The one that's sunken is called excavatum. Excavated, basically. The one that's protruding is called pectus carinatum or pigeon chest. What problem, if you see this, what heart disease is associated with these? Usually mitral valve diseases, especially MVP and TVP. These are associated with it as well as mitral regurgitation. What is this? This is barrel chest, meaning the anteroposterior diameter has increased, and we think of COPD. All right, who's going to answer the next one? What is this? It has both scoliosis and lordosis. Is that correct? What disease might occur simultaneously with these from a cardiac and pulmonary perspective? These usually have pulmonary hypertension. Because the lungs are under pressure, the pulmonary pressure in these patients is high, so they often have cor pulmonale and pulmonary hypertension together. What problem does this gentleman have? His back is kind of straight. He has straight back syndrome, which is also seen in ankylosing spondylitis. These patients usually have associated valvular diseases, especially MVP. Of course, aortic valve disorders are also present. All right, this is the last slide. If you observe hepatic pulsation, you should definitely consider severe tricuspid regurgitation. If there is splenomegaly, it suggests infective endocarditis. If the patient has ascites, it points toward right-sided heart failure and constrictive pericarditis. And finally, if the patient has abdominal pulsation, think of an abdominal aortic aneurysm. Abdominal aortic aneurysm. Wishing you success and victory. Thank you for your hard work.